program is brought to you by the Faculty of Medicine, Dentistry and Health Sciences at the University of Melbourne. Please visit us at www.mdhs.unimelb.edu.au.
Mulga, the red rocks, the rivers, some got water in it, some doesn't, but it's all there. After 30 years, people in the city don't see trachoma as something that needs to be treated. They see all the other diseases. But as I always said, you've got to be healthy to be on your land, to catch where those kangaroos are going.
When I look at a child with trachoma, what I see underneath the eyelid is a thickened red eyelid with little white dots that are called follicles. And this is the response to the inflammation and infection in the eye. What one sees in older children is the start of scarring, and the longer they have the infection and the more intense the inflammation, the more scarring they get. What you see when you look at adults and older people is these scars have developed and progressed further, and they distort the eyelid and cause the eyelashes to turn in and rub on the cornea or the front surface of the eye. And this ultimately we call scarring and blindness. When I look at communities that have trachoma, what I see are children who are living in poor hygiene conditions. They're often poor houses, poor water supply, often without latrines or ways of disposing of human faeces. But the key thing with all these other markers of poverty, the key feature is the children with the dirty faces. And the dirty faces are important because they provide a way to transmit the infection from one child to another. While trachoma has disappeared from mainstream Australia 100 years ago, we are not seeing that same change in these Aboriginal communities. And what's lacking is the vision and the commitment of the policymakers and those people working in the health field to set this as a target.
We won't close the gap on Indigenous health unless we tackle the problem of blindness. Trachoma is in our Aboriginal community, and we need to have a program to solve that problem.
Australia is the only country in the developed world to still have an active problem with trachoma. This is something which most Australians don't see, yet it is something which we can fix. We have the evidence, we know what the solutions are, what we need is the political will.
We saw the importance of supporting the Indigenous Eye Health program under the outstanding leadership of Professor Hugh Taylor, whose vision is to eradicate trachoma from Australia within the next 5 years.
What you see overseas is many countries, the governments have made a real commitment to eliminate or eradicate blinding trachoma in line with the World Health resolutions. What we see in Australia is things are no different this year from last year, no different last year from 30 years ago. We really need to see some action from our government and policy leaders to do something about this dreadful problem. What I see is an easy solution to this if one follows what's called the SAFE strategy promulgated by the World Health Organization. The SAFE strategy's got 4 components. It's got surgery to correct the interned eyelashes, the distribution of antibiotics to stop the infection, the promotion of clean faces so one reduces the number of kids with dirty faces, and an improvement in the environment to make sure that there are not barriers to facial cleanliness by the provision of water and so forth. And what we see as needing to be done is the commitment from the government to implement this SAFE strategy, which has been adopted as Australian policy, but it is just not yet being actually implemented in the ground. One should be able to eliminate trachoma in Australia within 5 years for less than $20 million.
This is a political commitment as well as a people's commitment. The thoughts, the visions are out there, but to be able to put it in place, you've got to have government support, but you also have to have support from the people to make sure that when I'm old, because all the kids, when I saw them, they're probably nearly as old as me, but I think we have to make sure trachoma is finished in the next generation.
This program is brought to you by the Faculty of Medicine, Dentistry and Health Sciences at the University of Melbourne. Please visit us at www.mdhs.unimelb.edu.au.